Okay, so I have 1:15 straight up. We will go ahead and get going with our weekly news conference regarding all things COVID-19 with the city of Bloomington, Monroe County, Indiana University, and Indiana University Health. I'm Chuck Carney, Director of Media Relations for Indiana University. We'll begin with some opening comments first from Mayor John Hamilton.
Good afternoon. Thanks again for all being here. Quick reports from the city. We're still at 63% in terms of vaccinations that have demonstrated the evidence to get the $100. I don't have wastewater reports this week. We didn't get the info back yet. We did have 6 new cases this week. That brings our month of September case count, positive case count for employees to 18. That's the highest month in 2021. The only higher month was December of 2020 with 20 cases. So that's a real indicator, at least from our workforce, of the prevalence. In fact, we had a substantial impact, as many know, at the sanitation department that had 4 symptomatic positive cases and 5 more close contacts. That meant we had to actually reduce services during this past week. We couldn't pick up recycling in the regular way. We did what we could, but just didn't have the person power to be able to do that. I will note that's really been in 18 months, the first significant service reduction that we've had to implement. On the one hand, I'm grateful for that. On the other hand, it's concerning that happens 18 months in, and here we are. But the folks are isolating and being tested, and we hope to return full services next week. Appreciate the extension of emergency from the state through October. Appreciate the extension of the mask requirement by the Board of Health. Similarly, it almost seems like we're just having to live with this. We do hope to see improvements. Some of the state data is going in the right direction. Locally, I know we'll hear back to the yellow status, at least on the map, but some good indicators. But we also, I think, will hear hospitalizations are still a concern. And I just want to remind folks, back in July, we were losing 3 or 4 Hoosiers a day on average to COVID. And while the deaths have come down a little bit lately, we're at 30 deaths a day in the state from COVID. It's 10 times higher. So we can't be complacent or miss the impact of that. Every one of those deaths has a terrible impact, of course, in a community and in a family and in a circle of friends. And the fact that we're 10 times higher than we were in July with largely avoidable deaths is just heartbreaking. And we have the answers, we know, with vaccines and boosters and masking. Appreciate all who are doing that. Appreciate the focus here locally on that. Just reminding, while we're kind of soldiering through this, there are real casualties every day, and it just reminds us the stakes and the need to continue to do what we can together. So I'll hand it back to you, Chuck, and take questions.
Okay, thanks very much. Let's check in with Monroe County and the Health Department and Penny Caudill.
Good afternoon. I will begin today with the regulations, and the mayor mentioned these. Governor Holcomb did extend his executive order through October 31st. And on Wednesday, the Board of Commissioners approved the extension of the Monroe County health regulation that requires masks in indoor public places. And that regulation is extended through October 31st at midnight, unless the county reaches 2 thresholds. We are in the blue advisory, and our cases per 100,000 fall below 50. This new regulation will be posted soon, and an alert will also be going out to remind people about the extension. Monroe County is still in an orange advisory. We have to be there 2 weeks, and we have to see 2-week trend of downward movement before we can change that to the lower level. So the good news is that our cases per 100,000 this week did drop to under 200, as did our positivity rate drop below 5%. So those 2 metrics would look like we are yellow, but because we were orange, we will remain in orange advisory for another week, as long as numbers continue to drop. If our numbers rise, we could remain in orange status after next week. I hope that makes sense. We are in orange right now. We have the potential to move to yellow next week if we see continued improvement. Unfortunately, we are still experiencing deaths from COVID-19, and we are seeing an increase in deaths at younger ages. While Monroe County has not had deaths in people under age 40, other counties have had that experience, and deaths have occurred in all age groups in Indiana. Vaccines, there is a growing concern for pregnant women who are unvaccinated and the risk to them and the pregnancy. The data shows that the benefit of vaccination of pregnant, recently pregnant, and women seeking pregnancy far outweigh the risks of vaccine. So please, if you have been waiting, now is the time to be vaccinated. Talk to your provider, get your questions answered, and vaccinate so that you can reduce your risks. The public health clinic does continue to make vaccine available at the Miller Drive site. All vaccines are available as supplies allow. Appointments are available Monday through Thursday and on Saturday, and we continue to hold school clinics and other outreach events. Visit ourshot.in.gov for a list of locations, including mobile sites across the state. In terms of booster doses, Pfizer received approval for booster doses, emergency use authorization. So if you are fully vaccinated and you have been for at least 6 months and you are 65 or over, or you're an adult 50 to 64 with underlying health conditions, or you're 18 and over and a resident of a long-term care facility, you should consider getting that booster. You may consider getting that booster now if you are 18 to 49 with underlying medical conditions, 18 to 64 at increased risk by your occupation. Pfizer has submitted data this week about its trials for ages 5 to 11. Moderna has submitted data to the FDA for review for boosters, and J&J has also submitted some initial data. So we are seeing some changes coming and continued review of vaccine data. If you have been vaccinated and you have lost your vaccination card, you can get a certificate statement that provides you with that information by visiting the coronavirus.in.gov/vaccine webpage, and you will see get your vaccination certificate, and then click here, and it will walk you through the process of getting that certificate printed for you. In terms of testing, the Indiana Department of Health and Gravity site remains open Tuesday through Saturdays, 8 to 4 p.m. It is located at 500 North Profile Parkway. That is Cook Properties. So if you are on the map and you're looking, the initial thing that you will see says Cook. And then as you drill down, you will see that it is the Gravity site. It is a drive-through clinic at this time. They will accept walk-ins. Just be very careful. They've got a system for that if that is needed. You can register on the site. You don't have to register online, and results are back the next day by 5 p.m. We are also working with the state to bring another mobile clinic to the county for a few days, which will have both testing and vaccine. This is expected to be arranged in the coming weeks, and the state is moving those mobile clinics across the state in an effort to boost access to both vaccine and testing. Again, for testing options, you can go to coronavirus.in.gov, see a full list of your options, including those mobile sites. And the last thing that I want to mention is that flu season is upon us. And last year, you may recall that the peak level of influenza was below baseline, and we can attribute that really to the measures that we were taking at that time. So I suggest that we continue all of those measures this season: good hand washing, masking, covering those coughs and sneezes, staying home when you're sick, get vaccinated. All those things will help both with COVID-19 prevention and influenza prevention. Flu vaccine is available and may be co-administered with a COVID vaccine. Back to you, Chuck.
Okay, let's check in with the Monroe County Board of Commissioners and Julie Thomas.
Hey, thank you, Chuck, and thanks everyone for being here today. As always, we appreciate it. Just a reminder that because the governor extended the order for another month, the Township Assistance Fund is still available for our county residents. Every county resident lives in the township, and our township trustees are the ones who are administering this for us. We work together with the council to provide this funding for residents who are struggling to pay for things like rent and utilities and basic necessities. If you're struggling and you need assistance, don't hesitate, don't wait. Please call your township trustee. You can access them through 211in.org. And also the list appears in the minutes of every commissioner's meeting. Also a note that we will have the next round of blood drives is October 21st from 2 to 7 and October 22nd from 10 to 3. This one will be held at the Southeastern YMCA. Go to redcross.org and sign up. We've had such a great response from our community of caring people, and we appreciate that. And it's also just a reminder, as Ms. Caudill noted, when we have a health order come out, we do place that health order on our resident alert system. All you have to do is go to co.monroe.in.us to utilize the system for free. You can select text, email, phone call, or any combination and how much information you want to get. And you will receive information about things like health orders, emergency evacuations. Some of the boil orders are there. Schools will sometimes use it, but definitely for weather and road emergencies as we're heading into the winter months, that's an important thing to have handy if we're going into an advisory. So I just want to take a moment to, on behalf of the board, to thank everybody who's wearing masks and who's gotten vaccinated. And it's a testament to your caring about your community and your loved ones in your household. And we really appreciate it. We appreciate your thoughtfulness. And we just want to encourage everybody to get vaccinated as soon as possible. It's never too late until it's too late. And so please do so. And please continue to behave with civility. I see all these things across the national news at school board meetings and attacks on healthcare workers. These are the folks who are our heroes, and we need to treat them with kindness and respect because they've respected us and they've been with us for the long haul, and we can't thank them enough. So with that, we'll take any questions. Thank you.
Okay, let's next check in with IU Health and Brian Shockney.
Thank you, Chuck. As this graph shows, our South Central region continues to see a steady volume of COVID-19 patients over the past few weeks. And the same trend for Monroe County. We're seeing a longer tail, though, in this surge than previous surges, potentially signifying that we may be coming out of this surge for a longer period of time than previously thought. What's the solution to getting this to decline quickly? Vaccinations. So there is some concern that we're hovering at this level that we didn't see in the previous surge as we come out. As we now are at the start of October, we have to remember that at September's close, this September of this year, August 2, but September of this year has been the third highest month for the number of hospitalizations for COVID-19 in our South Central region since the pandemic began. So as you can imagine, the deaths and physical toll our patients have experienced are just as significant. This Delta variant is very strong and should cause us to continue to respect this virus's power and ensure we protect ourselves and others. Knowing that the second surge has been so significant, I want to give thanks to our healthcare heroes and those who respond on the front lines of this pandemic that we've been fighting since March of 2020. Not everyone has chosen to stay in the fight, and for very good reasons. However, those that continue to care for us each day, as this is their life's passion, have demonstrated their resilience and are to be recognized at every opportunity that we have. So thank you, as our commissioner said as well, thank you for the fight that you are continuing to fight. As we shared last week, IU Health will continue to follow the CDC's recommendations concerning vaccinations. And for those who receive the Pfizer vaccine booster shots, we encourage everyone to get vaccinated if eligible. Currently, the CDC recommends COVID-19 vaccine booster shots for the Pfizer BioNTech vaccine recipients who completed their initial series at least 6 months ago and meet the following criteria: 65 years and older, 18 and older who have underlying medical conditions, 18 and older who work in high-risk settings, and 18 and older who live in high-risk settings. Those who fit the CDC criteria may obtain their third vaccine at our IU Health pharmacy at the Bloomington Hospital lobby by appointment, our community health offices on Miller Drive, or many of our primary care providers as well have already established patients that they are giving this booster to as well. And of course, has been mentioned a couple times, our shot.in.gov gives you locations where you can secure a spot and you can get your vaccine. Please be sure to take your vaccine card with you. Not mandatory, but it's always helpful when you do. And then, as Penny mentioned, it is that time of year for seasonal flu vaccines. The sooner you get yours, the better, as we also continue to battle COVID-19 as well as flu in this community. It takes about 2 weeks for a person's body to make antibodies after you receive the influenza vaccine. And so reducing the number of people becoming sick from the flu, it helps reduce these hospital admission rates, which is important. As we know, right now we're struggling as a healthcare system to just strain our resources to take care of COVID patients and other emergent conditions. The CDC estimates that influenza results up to about 45 million in illnesses, and 810,000 hospitalizations in the last 10 years, 61,000 deaths annually across the US. So it is just something we need to be concerned about. So you can get your flu shot at your primary care office within IU Health with an appointment, or we have many pharmacies around the community. You can get it at Miller Drive. Lots of opportunities for you to get your flu shot. You can even get your flu shot and your Pfizer booster at the same time, and we'd be happy to do that. The best way to prevent the spread of seasonal flu and COVID-19 is to get your vaccine now. And I'll be happy to take questions at the end.
Okay, we'll check in with Indiana University, and we have two representatives. First, starting off with Kirk White.
Hey, good afternoon, everybody. Let's start out with our statistics for the week. Again, a good positive trend. We're up to 92.8% vaccination rate at the Bloomington campus. That's up 0.1% from last week, but we're headed in the right direction with a few more people getting their vaccinations. And then on the COVID cases side, a significant decrease from last week, total of 30 cases this past week, 23 of those being students and 7 faculty and staff. That's down from 62 cases the week before, so a significant decrease there. Our trend has continued that way here for the last few weeks, so we're very positive about that at the Bloomington campus. Let's also talk about influenza. We do want to, again, promote our opportunities for our free vaccine clinics for the flu shots. We had one successfully last Saturday and administered 1,400 doses of flu vaccine. Our next one is coming up on the 12th of October, and then after that on the 24th of October. And we have more information about that. I'll post on the website to sign up. Both of those locations will be at Simon Scott Assembly Hall. And speaking of Assembly Hall, Hoosier Hysteria is Saturday prior to our away football game, but the basketball game will be at 4 o'clock on Saturday, tomorrow. And the reason I bring it up is due to the success we've had with the indoor mask mandate. Spectators inside Assembly Hall will be expected to have masks on. So bring your mask as you're coming to Assembly Hall for Hoosier Hysteria tomorrow. And just a reminder, fall break for the Bloomington campus is next Friday. So we'll see a little bit of a downtrend of activity around town, and maybe give some of our food service people and other providers, healthcare providers, even in Bloomington, Monroe County, a little bit of a break as folks may be leaving for a long weekend next weekend. And that's my update. Let me turn it over then to Dr. Carroll, who may want to add some comments about our trends university-wide around the state.
Thanks. I'll add just a bit, because I think Kirk hit most of our highlights. Everything is trending in the right direction. Cases are down, vaccinations are up. We're continuing to push for even more vaccination. We get people who had previously exempted themselves who are changing their minds, which we totally encourage, as well as trying to get everybody a flu shot as quickly as possible. We're seeing similar trends across all of our campuses. IUPUI has more cases actually this week than Bloomington did, but certainly not very many more. I believe that they had, 44 cases, 33 students, 11 faculty and staff. Most of our regional campuses had just a handful of cases. The rate overall for all campuses at IUPUI was 113 cases, 91 students, 22 faculty and staff. Our vaccination rate across all of the campuses is now at 89%. This is all good news. We're still not, at a point, I think, where we would make changes in any of our other policies. We're just continuing to push, good messages. We're happy that everybody seems to be doing the right thing, and continuing to try to keep our campus as safe as possible. We're still, of course, having to isolate, although very few people, again, have COVID, and very few of them are in our dorms, which means that actually our campus housing for COVID is barely being used much at all. But the state continues to have significant cases. The healthcare system, as previously discussed, while improving, is still busy. And so nobody's looking at this as like it's over or that the surge has ended, but things do appear to be heading in the right direction.
Okay. With that, we will open it up to the questions, and we have one from Dave Askins at the B Square Beacon for Mayor Hamilton. When will a decision be made about resumption of recycling pickup for next week?
Thanks for the question. Really, we're taking it day by day. We made the decision this week on Sunday when we learned about it. We're hopeful we'll be able to start it again Monday, full throttle, but we will probably not know that until Sunday. So we'll announce that through all the media that we can.
And also from Dave for the mayor, when the Kirkwood closure and parklets program was extended to the end of October, I don't think anyone thought we'd still be seeing the kind of pandemic numbers we're seeing now. Is there any thought to extending those programs a couple more months, so for whatever nice days we have in October and November?
Yeah, it's a good question. Thank you. I agree. I think that will be considered. As you probably know, I think I've said, the city works very closely with Downtown Bloomington Inc. and the establishments themselves to see if their interest. There's no reason to close a street if it won't be used, but we'll be continuing to discuss, and people will be voting with their feet, I guess. I was actually on Kirkwood last night. It was busy and lots of people enjoying the beautiful weather. We will be working to figure out what's the best way to keep people enjoying safer entertainment. It will depend upon work with the establishments along those at that location.
From Dave again for Penny Caudill, will the health department be making a visit to Seven Oaks to check on compliance with the order, or would that have to be based on a specific complaint, meaning Seven Oaks Charter School?
Yeah, I saw that there's another question about that as well. We will follow up. Any site visits that we do are unannounced, so I won't give you any kind of a timeline about something like that, but we will follow up, and certainly complaints will receive follow-up as well.
Okay, remember to unmute. Okay, and that I think answers Patrick's question as well. Kirk has posted up the vaccine site information for IU if you want that information. Here is another question from Phyllis Cha at WFIU, this one for Aaron. Why are there not campus-specific numbers for how many of the 12,006 people who met an exemption from the COVID-19 vaccine came from each campus?
Well, I mean, you can almost back calculate back. I don't think we're putting up numbers for anything. We're mostly talking about percentages. You can see what percent of people are vaccinated. Almost everyone else who's left has obtained an exemption. There are some small number of people that we don't know whether they have been vaccinated because they have not yet told us or don't have an exemption, and we're tracking them down and reducing that number every day, but we treat them as if they're unvaccinated. We ask them to test as people who are exempt were, and so they're testing until that they tell us they're vaccinated. So the percentage who are not vaccinated, as reported on the dashboard, is the number close to of how many have exemptions.
Okay, we'll wait here for another question. Not seeing another one at the moment. I will do my usual fill by promoting the IU site for COVID information, which is covid.iu.edu, where you can find the dashboard, which is updated on every Friday morning as well. So happy to take more questions as we have them here as well. Just double checking. It looked like I was muted again. So checking here. I'm okay. Patrick, I'm seeing your questions. Just let me, just as a record thing here, Patrick emailed me some questions. Just I will not be able to keep them straight on email between this and that, so I would much prefer they be put in the chat, because you're asking me to look at two different places during the live webinar. So this one for Brian Shockney and IU Health: to what extent are our hospitals using monoclonal antibody treatments for COVID-19 patients?
We are using them quite a bit, actually. So we have been doing that through this surge. We're averaging about 7 patients per day that we are giving the antibodies to here in Bloomington. Paoli has now stood up a monoclonal antibody site as well. So they are giving that as well. So yes, we are, it is working. We are keeping people out of the hospital because they are testing positive, and we're getting them these monoclonal antibodies quickly. All of the IU Health facilities are either have the ability across the state or are getting that ability quickly. So whereas in the first phase and surge of this, we didn't have as much supply of it, and we didn't have as many places where you could go. Now we have the ability for almost every location to be able to give people those monoclonal antibodies, which is a great thing in keeping people out of the hospital.
And let me follow up. He's got some follow-ups that are all related on that. So first of all, are patients and doctors seeking that treatment? And can you measure how effective it has been in treating COVID patients? And is there enough supply to meet the demand?
So I'll take the first one. I'll take them in order there. Are patients, doctors seeking that treatment? Yes, they are. The word is out strongly. All of our physicians, we continue to communicate to them. That's why our slots are being filled every day, and we're providing these infusions every day to our patients. So this is being used very well. Can you measure how effective they are? I do not have any data to demonstrate for those who we care for, but there's great evidence out there across the nation and other places that this does prevent severe symptoms, as well as prevents hospitalization, specifically for those who are immunocompromised and would normally get the COVID virus and end up in the hospital. And is there enough supply? There certainly is. We check that every day. So part of our incident command, we talk about 72 hours out. So that supply is ordered on a daily basis. And so we say how many are scheduled 72 hours out and how many doses do we have available to be sure that we never run out and we never schedule a patient. Or if we would ever happen to have a short supply, we would know 72 hours out that we need to contact the state or we need to get supply from another location within IU Health. But we have not had any issues here in the South Central region with running out of any supply.
Another question from Dave Askins for Commissioner Thomas. Is there any possibility that commissioners would start holding the Wednesday meetings in a hybrid way, even though the governor's order means that they can continue to be purely by video conference?
Great question. I think the issue for us is we've left it so that we're following the governor's order. And the reason for that is because it is such a popular meeting and the hall gets packed, we want to make sure that everybody is safe. We just can't control for how many people might show up, and that's the issue. So the Nat U Hill is in its new sort of television studio reconstruction. And we are looking forward to getting back because that will mean that the county's in good shape health-wise. We like what that signifies. But for now, we're going to stay video only until that time when the coast is clear, as they say. Thanks for the question.
Okay. Don't have another question here, but I will wait just a moment before we give up the ghost for this session until next week. Let's see what I did there. It's October, so you have to work in ghost references. But this is what happens when we have time to fill, Mayor Hamilton. So we will take your questions if you've got any others. Otherwise, we will be back again next Friday at 1:15 for another update on the COVID-19 pandemic across all of these sectors. And I'll put in one other plug for the webinar with Aaron Carroll, the Ask Aaron session, which is every Wednesday at noon. Those of you at IU know about that, but the archived ones are also available on our covid.iu.edu page. And Aaron is quite good in answering all kinds of questions about COVID in that session. So if I do say so myself. Not seeing anything else, we will call it the end of this session and plan to see you again next Friday at 1:15. Thanks, everybody.
Thank you.
Thanks. Get vaccinated.
Have a good week.
Thank you.